Good day everyone, this is Rocky Macasio, BSN1D from Medical College of Northern Philippines, and I will demonstrate to you on how to assist the 12 cranial nerves. But first procedure is perform hand hygiene and put on gloves. We don't have the specific material which is the goggles, so we just assume that we've already put it on. And of course, after putting gloves and goggles, we prepare the work area and assemble the materials. So the first nerve that we assess is the olfactory nerves, which are responsible of sense of smell. But before that, let us identify the patient first. Good day, ma'am. I am Rocky Macasio, and I was assigned to assess your olfactory nerve. Is that okay, ma'am? May I know your name, ma'am? What's your birthday, ma'am? Ma'am, can I please check your nasal passages if they are clear, ma'am? Okay, so far they are clear. Ma'am, can you please close your eyes and shut one nostril with your finger and sniff this odor and identify them, ma'am? That's correct, ma'am. The other one, ma'am. Okay, that's right, ma'am. So the patient identified the odors correctly, and the olfactory nerve is normally and no signs of abnormalities. So for the next procedure is let's us proceed to optic nerve, which is afferent to the brain, responsible for the sense of vision by visual acuity. By using Snellen chart 6 meters away from the patient, testing each eye separately. If the patient uses glasses, ask them to put them on. Ask the patient to read from top down until he can no longer distinguish the letters. Visual field confrontation test. Ask the patient to cover one eye and look directly to your opposite eye. Shut your other eye to wiggle your finger in each of the 4 quadrants and ask the patient to state when the finger is seen. So from the 3 tests, we first do the visual acuity, which we use Snellen chart 6 meters away from the patient and ask the patient if it used glasses. Ma'am, do you use glasses, ma'am? Okay, while we doing this, we do it one eye at a time. Okay, ma'am. Okay, ma'am, can you please read the Snellen chart from the top to the bottom with your one eye only, ma'am? Can you please close your eye, ma'am? Okay, ma'am, start. Okay, ma'am, the other eye, ma'am. Okay, ma'am, your 2 eyes, ma'am. After reading the Snellen chart with her left, right, and both eyes, it reads it correctly. So we must say that her visual acuity and the optical nerve is normal and no signs of abnormalities. Now let's move on in assessing the visual fields of the patient. In assessing the visual field, we ask the patient to shut her one eye at a time and look at her opposite eye. We do that as well. And put your fingers in the 4 quadrants and ask the patient if he sees it. Okay. Ma'am, can you please shut your one eye? And look at my eyes, ma'am. Can you please state this number? Okay, the other eye, ma'am.
1.
And after assessing identifies my fingers and the numbers that I've assigned, which leads to her visual fields is normal and no signs of abnormalities, which is good. So let's proceed to the third test, which is the light reflex, and we use a pen light and ask the patient to look forward and light her pupils obliquely. So ma'am, can you please look forward as I light your pupil? What is that? Okay, ma'am? Look forward, ma'am. So as I assess her light reflex, we can say that I observe that it has a direct and indirect response. So overall, we can say that her light reflex is normal and no signs of abnormalities. So let's proceed to oculomotor nerve, which is afferent to the brain, and we look for ptosis and squint. We are going to do the right reflex again here in this nerve, but we've already done that in that last procedure, which we find a good findings. So let's proceed to the accommodation, which remove ocular motion or have H shape and exam. Now we have here an object and ask the patient to look at it. Ma'am, can you please look at this object and focus here? As I move this object, I observe the patient that his eye pupils are copying this and it is normal, which is good. So let's proceed to the trigeminal nerve, which is we assess the ipsilateral phase, general sensation, touch, pressure, temperature, pain, vibration, and anterior 2 to 3 of the tongue, general sensation. Ma'am, can you please stick out your tongue? It is okay, ma'am, if I touch it, ma'am. Do you feel any pain, ma'am? Okay, so the temperature is warm, ma'am, which is good. And the color is good. So there's no signs of abnormalities, which is good. So let's move on to the motor of the patient. So as for the motor, which supplies muscle of mastication, note any wasting of muscles of mastication. Ask the patient to cleanse his teeth, then feel the masseters and estimate their bulk. Ma'am, can you please cleanse your teeth? And your temporal. As I assess it, there's no signs of abnormalities, which is good. Ask the patient to open his jaw against the resistance of your head and note any deviation. Ma'am, so can you please open your jaw? Again, ma'am. Okay, she can do that, so we can say that it is normal. So now, let's proceed to the corneal reflex. I have here a cotton damp wood and ask the patient to look upward. Ma'am, can you please look upward? Look upward. So if the patient blinks, and that's the normal finding, so we can say that there's no abnormalities by assessing her corneal reflex. So let's now move on to the jaw reflex. Ask the patient to open his mouth hanging loosely. Ma'am, can you please open your mouth? Place your forefinger in the middle between lower lip and chin, then percuss fingers. And note any reflex, setting of the jaw, normally it is absent. So, we can say that her jaw reflex is normal and no signs of abnormalities. Now, let's move on to the facial nerve, which is sensory taste sensation of anterior 2/3 of the tongue by applying cotton buds of the patient's tongue dipped in sugar, salt, vinegar, quinine solutions with rinsing his mouth out between each test. Ma'am, can you please close your eyes and identify this taste? Open your tongue. Okay, that's right. abnormalities and the findings are normal. Now let's move on to the motor. Note on any symmetry, whole face, blinking eye closure, or flattery, and of the nasophial folds. Ask the patient to wrinkle the forehead or look up. Ask the patient to bare his teeth. Ask the patient to screw his eyes and keep them closed while you are trying to open them. Ask the patient to blow out his cheeks. Ma'am, so can you please wrinkle your head? Look up. Okay, ma'am, can you please bare your teeth? Okay, ma'am, can you please close your eyes? And I will open it. Ma'am, can you please pop your cheek? So, okay, ma'am. So, the patient can perform all the things that I want her to do. So, there are no signs of abnormalities and the findings are good. But now we move on to corneal reflex, but we've already done that in the last procedure, which we note a good findings. So now let's move on to glabellar tap. Okay, ma'am, so I will tap this part of your body. Okay, so it is normal because she blinks. Because the normal response of the nerves should be blinking. So there's no signs of abnormalities. So let's now proceed to the vestibulocochlear nerve, which I assess, as I said, our 2 feet away from the patient, and she can able to hear it. Ma'am, so can you please identify what are the words I said while I close your one ear? Okay, ma'am. Okay, that's right, ma'am. So the patient hears the words that I said 2 feet away from her. So that's the normal response, and we can say that there are no signs of abnormalities. So supposed to be, we must also test the Weber's test and the Rin's test, but we don't have the specific tool, so we just assume that we've already done that and we find a good findings. So now let's move on to glossopharyngeal nerve and ex vagus nerve. So ma'am, can you please say ah? Okay, ma'am, the movements are good. Okay, it has a gag reflex, and that's the normal findings of it. Ask the patient to puff out his cheeks with the lights tightly closed and feel for air escaping from their nose. Ma'am, can you please puff up your cheek? Okay, so I can feel an air pressure going out at her nose, and that's the normal findings. So for the vagus nerve, let us test the water swallowing. So can you please swallow this, ma'am? So observe for the swallowing of the patient. And as I observe, there are no signs of abnormalities, and that's good. So how are you, ma'am? So the voice quality is normal as her voice earlier. So that is good, and there's no signs of abnormalities. Now let's move on to accessory nerves. Observe for any shoulder or neck muscle wasting or hypertrophy. So ma'am, can you please shrug your shoulder, look up and down, side to side. So she can do that. So her nerve is intact and normal, and that's good. Now let's proceed to the last procedure, which is the hypoglossal nerve. Observe for wasting, fasciculation, or involuntary movement. Protrude tongue and look for any deviation or involuntary movement. Move tongue to tongue. Ma'am, can you please move out your tongue, ma'am? Move side to side. Okay, that's good. After that, we proceed to test power by asking the patient to press his tongue against his cheek while I apply my pressure from the outside. Ma'am, can you please put your tongue on your cheeks? Okay, that's good. And after that, assess his speech and swallowing. We've already done that in the earlier procedure, and we find a good findings, so it is normal. And after that, document the findings and do the hand washing. So ma'am, hand washing.